Another Plap2 station with Dr. Al. So something extremely common I'm gonna talk about in this video. I'm not aware if this has ever popped in Plap, but at the same time, this is a very, very, very common condition that you really need to know how to approach from a Plap perspective. I am a 55-year-old man who presented with shortness of breath, chest pain, cough, fever. So I have four complaints. You need to explore all these four. Chest pain, you know the mimic, Socrates. Shortness of breath, Odipara. Cough, bringing up sputum, or dry cough, bringing up sputum, then you need to go with track. And finally, fever. Very important to explore all symptoms. Then past medical history. This is extremely important because if I have a history of stroke and I'm on atorvastatin, you want to be careful with which type of antibiotic you start me on. Past medication the patient is on is also very important. Family history, is it really important? Not that important. It could be important in the management, I'll tell you why. Travel history is important. What if the patient has atypical pneumonia, Legionella, stuff like this? Smoking is important, alcohol is important, diet and exercise are not that important, to be fair. So, we get to the examination. Definitely you're going to examine everything, but you want to keep in your mind curb 65. Why? Because this is an indication to admit. So once you examine the patient, make sure to ask this question. I know this question might sound strange, but if you don't mind, can you tell me where are you and which day are we in? This will let you know if the patient is confused or not. You want to once you examine, you want to verbalize that I'm going to check your blood pressure, curb and the B. Then I'm going to check your respiratory rate. And I'm also going to send a quick blood sample to check for your urea. Once you've done these, the consultant in the room is going to know that you are aware of curb 65 and the indication to admit. So then based on the score of curb, you admit and you start antibiotic. You don't have to name the antibiotics, but once you start the medication, make sure to ask the following question. Are you allergic to anything? Hypothetically speaking, I am allergic to penicillin, so you're most likely going to start me on Clarithrol. In this case, if the patient is on atorvastatin, make sure to say, we need to rationalize your medications. Some medication might interact with the antibiotic that we're starting you on. These medication needs to be stopped. At this point, do you need to refer to anyone or check with your seniors? No. Refer to A&E if you're going to admit the patient, if the patient has a high curb. Finally, chest x-ray after 6 weeks as a follow-up.